This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. Hi there again, it's Professor Chapman, and I'm tonight going to spend the FaceTime Live talking about male infertility. The reason I'm talking about it is that this morning in my clinic I saw 5 patients and 3 of them had a male factor problem. So, and I can tell you that in each of those situations, the male was looking pretty downcast. That to be told that your sperm is not so good is a bit of a blow to the man's ego, and psychologically is quite an issue. And dealing with that and working through that is actually very, very important. So the first aspect of the psychological impact of male infertility is not insignificant and often missed by specialists, particularly gynecologists who only trained to treat women's infertility. And you've got a poor sperm count, tough, and let's get on and do something. Not really think about the fact that being told a poor sperm count is a kick in the what's-its, really. That obviously having sperm in good numbers is part of your virility. First myth in that is, of course, that the sperm count doesn't necessarily affect your male hormones. The testosterone in most cases, even when the sperm count is not so good, is absolutely fine. You can still have your erections, you can still have intercourse. It's just that the sperm numbers are poor. So it's not necessarily a suggestion that you're no longer a strong male. The testosterone is what tells us about that. So actually acknowledging it, and the sad part to some extent is when couples have been trying to get pregnant for a while and it turns out that it's a male problem, the finger pointing does start, which doesn't do much for a relationship. So the woman has to understand that there is a problem and that there's more than just a poor sperm count. It's actually psychologically quite a demanding situation for the male. Anyway, so beyond the psychology and the drama that goes with having a poor sperm count, the question is, should we be optimistic? And in the vast majority of cases, in men with low sperm counts, pregnancies will still happen by one way or another. And that's an opening line in my discussions with men when I break the news about their sperm count, is that it doesn't mean you're not going to have a baby. We'll go back to what male fertility is about. Obviously, having an erection and putting the sperm in the right place is vital to that process, and there can be issues there from a sexual dysfunction point of view for many, many reasons, but I'm not going to spend time on that. The next part of it is the actual sperm quality. What is sperm quality? We talk about men having poor sperm quality. What has happened over decades now is that the World Health Organization has looked at various criteria in a sperm count and looked at men who have conceived or produced a pregnancy. In other words, what is a normal male to produce a normal rate of conception have to do? So when we get the guy to produce a sperm sample, what we're doing is looking at those various parameters and see how they relate to this particular sample. So we start, and there are multiple little bits to a semen analysis, but the important ones are What is the sperm concentration? How many million sperm per mil do we find when we do the counting? The first thing that we all look at. So when we look at that, what we're looking for is a count more than 15 million in every mil of sperm. The average is probably more like 40 to 50, but at counts above 15 per million, provided everything else is normal rates of conception occur. So that's the first cut-off line. If we go down to 12 million, we call that mild oligospermia. If we go down to 5 million, significant oligospermia, and below 5 million is severe oligospermia. Because less than 5 million per mil has almost 1 or 2% chance in 12 months of producing a pregnancy. So the odds are very low of producing a pregnancy naturally with counts of that sort of number. And then there's a group of men, which is probably 1 or 2% of all the infertility patients I see, have no sperm at all. And we'll talk a bit later about why that might be. But they're the gradings that we look at. Normal, mild, moderate, and severe oligospermia, and azospermia, which is the absence of the sperm. So the issue of what to do, let's go a little bit further. Okay. So that was all about concentration, and that's the number one thing we look at. But those sperm also have to be swimmers. And to get a normal rate of conception, you need to have more than 32% of your sperm swimming around. So you can have 70% of them lying on their backs, but you need 32% at least to produce a normal chance of a pregnancy naturally. So we look at motility. The next is looking at what's called morphology. In other words, the shape of the sperm. Are you a tall, dark, handsome sperm with a nice long tail, wriggling around with the right proportions of head, neck, and tail? Interestingly, when you get very strict in that criteria and you only like 6 foot tall men with brown eyes and good physique, if you're looking for that one, which is what they use as their criteria, really, in a normal sperm count that produces a normal rate of conception, if you've got more than 4% of those, you're in. And that seems a bit strange that 96% of them don't fulfill those criteria. But the evidence is there that if you're down around 2 or 3 or 1% of your sample that are normally shaped, you don't have a broken neck or a bent tail or a short tail or 2 tails. If you're down around those numbers of 1, 2, 3%, fertility rates drop off quite dramatically. So it is a criteria that we look at. Even though it sounds pretty awful that, although you've got a good count and a good progressive motility, you've only got 4 or 5% normally shaped sperm that fulfill the criteria of normality. But that's what the data says. So we sit down and we look at all those numbers and think about, has this man got a problem or not?
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.